I'm very pleased to be joined today by Professor Nita Forouhi, who leads a program of research into nutritional epidemiology and who very kindly agreed to come in today to talk to us about food for health and food for thought. Thank you very much for joining us.
It's such a pleasure, thank you.
In your work, you've conducted lots of original research, you've reviewed a lot of the field. It's such a confusing field from a non-expert perspective. It's a very confusing field, and for the lay person with findings, as you've pointed out, contradictory findings sometimes. What's your take on the quality of the evidence about nutrition and health?
Okay, you're absolutely right. There is a massive amount of research. Some of it is excellent and some of it is really poor quality. So we have to be very careful how we sift through that evidence, because when we give advice for people in the population to follow, or for the government to give advice on food and health, it needs to be based on the very best evidence. So we should, of course, apply the same criteria as we apply to any other research. We look at the quality of the study in terms of its size and the design of the study, as we say, whether it's a randomized controlled trial or whether we have simply observed people. And in a field like nutrition, it is very hard, of course, to do trials. So we have to work around that and look at the rigor which the researchers have applied to observational study, see if we can repeat it in different countries, different populations, and if the findings are very similar, then I think they certainly can help us advance the understanding. So if I give you an example, when we started with the research way back when in terms of cigarette smoking and tobacco and health, of course it was all based on observing, not on running experimental trials. And from that, as long as you apply rigid and strict criteria for appraising quality, you can do that for lots of behavioral things like diet.
When you have reviewed all the evidence, from that, what is your advice on how the average person can eat healthily to optimize their health?
Well, there are factors that apply to the individual, and there are factors that are beyond the individual that will also influence and affect what they eat and what they can afford to eat and so on. At the individual level, of course, it's really important to have information and education about what food and what diets and what nutrients are good and bad for you. So the excellent thing is that, at least for physical health, in terms of whether it be diabetes or heart disease, stroke, cancer, and also understanding dietary factors that lead to obesity, we have made generally in the research community a lot of excellent progress. So with that, we do have some really good things in the toolbox, if you like, of what is a healthy diet. And typical things, we have public health messages already on increasing our fruit and vegetable intake. There's the 5-a-day message. The message has been out since the 80s, but the number of people or proportion of people in the population who follow it is still very small. So in the UK, we know from the National Survey of Diet that it's about a quarter of the population that follow that. So we have a long way to go, but that's just one example. We have we're fortunate in this country to have really good public health guidance on diet. So fruit and vegetable intake is one factor. The other is around the balance between different nutrients and keeping saturated fat intake low. But when you cut that down to replace it with good fats, which are what are called polyunsaturated fats, things that you get from things like fish, for example. There's advice on eating fish regularly, up to 2 portions a week to get the good fats, for example. So these are just some starters. There's also evidence on diets like the Mediterranean diet, because ultimately what matters is not just what individual nutrients like fats or carbohydrates you eat, but what foods they're coming from. And ultimately, what overall diet quality or dietary pattern is within which those foods fit. So all of these factors are important, and education and information is key at the individual level to facilitate that. sugary drinks is one other example. That's a sort of win-win and quite an easy win situation where we know, and we have generated some of the evidence, and others have of course generated excellent evidence too, on the link between sugary beverages or soft drinks and the link with obesity and with diabetes. And now we know in this country that we have a levy or a tax direct to the manufacturers to push them really to cut down the amount of sugar in drinks. So that's another public health message. And again, information and knowledge is important. And what I mean by these other factors which are beyond the individual, that's more to do with what foods are available, how the supermarkets place their products, how the takeaways and fast food outlets are located, and how often we face them in our day-to-day journeys from home to work and so on. So what I call the foodscape, or what is around us, the environment that the food is distributed in, that also makes a difference. So there is a move in public health terms that if we make the good or the healthy diet choice the easy choice, so people don't have to apply too much thinking into, is this good for me, is this bad for me? If they were available at good prices and frequently, then that would make a huge difference. So really the point I'm making is, it's up to the individual ultimately what they put in their mouth, but the food environment around them also helps to shape what they might be able to put in their mouth.
Can I ask about dairy? Because that's something that previously people have sort of felt is maybe quite fatty and not very healthy, but my understanding from what you said is that it may be a bit more, that may not be as simple as that some dairy is good for your health.
Yes, absolutely. So there's been, an age-long interest in dairy products, and classically, we used to think of dairy as important in terms of having calcium and being good for bone health. But increasingly, both our research and other research has been increasingly showing that there's an association between particularly what we call fermented type of dairy, that is things that have gone through a fermentation process in the making of cheese or in the making of yogurt. They do seem to be related quite consistently across studies in the world with reduced risks of heart disease and diabetes, and some obesity studies too. For milk, the evidence is more mixed, actually. It's something to do with perhaps the probiotic content in terms of the fermentation process, the effects perhaps on the gut microbiota, as we call it, or the gut microbiome, plus some of the other nutrients that are in the dairy that are helpful, but also the type of saturated fat in dairy we think might also be healthful and beneficial, because although for decades we've understood overall that saturated fat is not so good for heart health, saturated fat, the exciting finding we have is that saturated fat is not just one homogeneous thing. It's made up of lots of different types of saturated fatty acids, and the fatty acids that come from dairy products might in fact be healthful. This is still in the research phase. We're doing more work on this to try and really get to the bottom of the different types of saturated fatty acids, but it's really encouraging. And therefore, for people who don't need to cut out dairy from their diet for other reasons, such as if they're vegan and so on, then it seems like it's quite a healthy food. So that's quite new understanding.
The Mediterranean diet, as you said, often comes out as very good for our general health, but it can be a bit expensive, although my understanding from what you said is it doesn't always have to be the most expensive, and some people have looked at ways of trying to make it a little bit more affordable.
Yes, absolutely. So the Mediterranean diet, of course, the key features of that are to have a diet that is low in red and processed meat, to have a diet that is high in fish and seafood, and to have lots of fruit and vegetables. Olive oil is an integral part of it. Now, some of these items are, of course, expensive. So there has been a general perception out there that, oh, well, how can some families afford to go on these diets? A research group in Australia, for example, has recently done a randomized controlled trial putting people with depression on Mediterranean diet, which is a modified type, where they've been very creative about how they would achieve the fish intake and the healthy fats and oils and so on. And they've used tinned tuna, for example. They've used frozen fruits and vegetables. So they overall found in their trial that Mediterranean diet, in terms of overall management of people with depression, it was overall cheaper, in fact, than the alternative in terms of business as usual without an improved diet quality. So that's one way of being creative about it.
Was it helpful for the patient's depression symptoms?
So I'm not an expert in mental health disorders, but I know from this work, which is by Professor Felice Jacker at Deakin University, their trial results are published. It was a small randomized control trial, and indeed they found that people who adhered to this modified Mediterranean diet had far fewer symptoms of major depression at follow-up at 3 months. And there was what we call a dose response, which means the greater the people were able to stick to that diet, the greater the reduction in their depression symptoms. So this is very encouraging. It's a small trial, but more work needs to be done. But I think this is a great start, that this type of diet could be helpful in mental health disorders as it can be helpful in physical health disorders.
I believe there's some meta-analyses as well that suggest that dietary interventions can be helpful for mood.
Yes, absolutely. So there is at least one meta-analysis that I'm aware of, which has put together tens of different studies of different types of dietary interventions, and overall there was a benefit for reduction of symptoms in depression. There was no significant effect for anxiety disorders, but there was for depression, and there was a greater effect in women than men. Now, meta-analyses, even when there are randomized controlled trials, of course, are challenging. They have their own limitations, but in terms of the first step to demonstrating that different dietary regimes, healthy diets, and avoiding poor diets, how they can impact on mental health, I think this is very encouraging, and it should be followed up with better quality research.
I'm very interested in that because as a psychiatrist, I'm often very keen, and my patients are often keen to know what they can do to improve their depression.
Absolutely.
That isn't just taking a tablet. And so here's something that I think I might start advising. I suppose one can't promise that the evidence is absolutely rock solid yet, but we know a Mediterranean diet now is likely to improve someone's general health, and it might well improve depressive symptoms as well.
And it certainly won't do any harm. So I think there isn't a lot at stake in terms of taking that step as a clinician to start advising it.
But really, this whole field of nutritional psychiatry is rather new, isn't it?
It is. So it has taken several decades to move the field forward for diet and physical health. And of course, there are still some major controversies which slowly are being addressed. But overall, we have a pretty good understanding of the sorts of what a healthy diet looks like. For mental health, of course, the prediction would be that what is good for the body would also be good for the mind, but it's not a given. And there will be some important specific detail that perhaps would be different. So things like specifically what the role of, say, omega-3 fatty acids or fish oils might be. What would be the role of a very low carbohydrate diet or a low carbohydrate diet versus a low fat diet. All of these things should be studied specifically for mental health, but the early start in nutritional psychiatry is encouraging. A lot more needs to be done, and I think what will be really helpful is researchers and clinicians who work in psychiatry and who work in nutritional epidemiology and in diet and health. I think if they collaborate more and if they put their forces together, I think this will lead to the best sort of research rather than people working in their silos.
I believe, well, certainly observationally as a psychiatrist, I've noticed that sometimes patients with severe mental health health problems find it very challenging to eat healthily. When one isn't feeling one's best, it's difficult to have the motivation to cook. There can be social isolation, can be a barrier to cooking and eating healthily as well, can't it?
Yes, absolutely. So this is what we call, if you like, a bidirectional relationship, which means the link between eating poorly and developing mental health problems also works the other way around, where you have mental health problems and you eat poorly. So it goes both ways. And the mechanisms aren't fully understood, but there's certainly some emerging research in this field. And there was a meta-analysis which looked at people with bipolar disorder and schizophrenia and major depressive disorder. And people with these, compared to people without these conditions, certainly had higher total energy or calorie intake, and also higher sodium or salt intake, and generally higher intakes of sugary beverages and lower intakes of fruit and vegetable intake. Now, there might be many drivers for this. It could be the medication they're on, it could be the symptoms of the mental disorder itself. There might be biological reasons that we don't yet understand in terms of what drives their hunger and satiety and cravings, perhaps, for things like salt or sugar. But these certainly are important to take forward and study. And, again, an area for more research, but at least we've made the observation that people with mental health disorders perhaps do have a propensity towards poorer dietary intakes.
And we certainly know, don't we, that people with severe mental health problems have reduced life expectancy,
right,
and are at risk of or at increased risk of many slightly worse long-term health outcomes. So I think that's been really important that we in mental health recognise that,
yes,
and we're trying to
yes,
take efforts
yes,
to address it. But behaviour change is hard, isn't it?
It is. So, your original point really is absolutely key. This, again, bidirectional link between physical health and mental health may well have some shared pathways. So, say if a person with type 2 diabetes has depression, a person with depression is also more likely to have type 2 diabetes in this two-way sort of link. And a common feature of both of those could be, for instance, underlying obesity, which might be in turn related to greater calorie intake or poorer, unhealthier diets. Behavior change, as you say, is very, very difficult, but that doesn't mean we don't try, because the alternative is to purely only be on medication, and that too has its own challenges and problems. In my field of research, which is based on diabetes, we have recently got research evidence from a trial that was conducted, showing that if you can lose weight through dietary means, you can reverse your diabetes or go into remission from type 2 diabetes. Now, that's a game changer in the field. It's hard. No one says it's easy to go on those very low-calorie diets to reduce your weight, but we know from the people who have been in that study, their follow-up, that once they have controlled their diabetes, they get a new lease of life, and their life expectancy is increased, and they come off medications. So the pain is worth the gain, so to speak. Behavior change is hard, but I think we can also put some support behind it so individuals don't feel isolated in doing it all by themselves. So some support from the clinicians and from community services and structured programs, peer support. All of these are very many different ways through which we can help individuals to adopt healthier eating habits and other healthier lifestyles, including alcohol intake, including smoking, physical activity levels, all of these.
Well, I think that is very encouraging to know that there are things that people can do. And actually we have in psychiatric services, I suppose, for some of our patients with the most severe mental health problems, we do have lots of contacts in terms of support workers, and a patient might have a care coordinator, right, often a psychiatric nurse, right, and then psychiatrist input as well. So we have many opportunities to help support people improve their diet. But it's good for us as mental health professionals to keep up to date so that we know how to advise our patients.
Yes, absolutely. So, I talked earlier about education for individuals and patients, but of course we also need education for healthcare professionals so that they can be enabled to help their patients better. And different care professionals in different fields can learn from each other. Yeah.
Thank you very much, Professor Forouhi. Thank you.
Thank you very much. It's been a pleasure. Thank you.